Hey everyone, I'm Dr. Jerisa ER. I am board certified emergency medicine. I help confused, anxious, stressed out patients in emergent health conditions. With my expertise, you will get back to baseline again. So today we're talking cervical cancer and your tips for the ER trip. Cervical cancer, January has been Cervical Cancer Awareness Month, and hopefully many of you have heard a lot about it and have been educated about cervical cancer. We have been fortunate at Vital Care to have been able to give away free Pap smears, and it's a little bittersweet because you realize that so many people still do not have health insurance, or are considered underinsured, meaning they have insurance, but their deductible is so high, they have a $750 deductible that they have to pay everything until that deductible is met. So we've been able to help girls get their Pap smear, and especially after the show last week, we had great response, and we're doing this in honor of my friend Angel Freeman, who was diagnosed last year with cervical cancer and underwent chemotherapy. So I have a few things that I want to really share with you, a few tips, because cervical cancer has become a passion of mine. In October, everything is painted pink. We see a lot of breast cancer awareness, but who knew that, January was Cervical Cancer Awareness Month? I even know women who have cervical cancer who didn't know that January, was Cervical Cancer Awareness Month, and the color is teal. So there's still a lack of knowledge out there, and I'm really glad that at least this month, it seems as though we were able to kind of help increase the knowledge for women to still get their Pap smears, even if you're later in age. Some of the things I want to share with you, the first thing I want to talk about is the HPV vaccine. It's not just for girls, it's also for boys. And here's the reason why. Because cervical cancer, 14 million Americans at some point will get HPV. There's over 40 different types, 40 different strains of HPV, which means that at some point, you're going to probably get HPV. That being said, HPV causes more than just cervical cancer. It also causes anal cancer, rectal, oral cancer. So when you think about all the types of cancers it can cause, you want to encourage and just order it for your kids, your teenagers. It's best to get it when you're younger. You can get it starting at age 11 and 12 up to age 26. So if you're 25 and you see this, you need to ask your doctor about the HPV vaccine. There's a lot of misconceptions about vaccines in general. You have vaccines that can help prevent you from getting, a rash or a major virus, but this is a vaccine that can prevent you from getting cancer. So sign me up, okay? Consider getting the HPV vaccine for your girls and your boys, because it can prevent cancer. The other thing I talk about is the misconception with HPV. I hate to say misconception because there is some truth to it that, when you get HPV over time, it goes away. It resolves. You no longer have it. That is true for the most part, because what I really want you to think about instead is that because there's over 40 different types and 14 million Americans get HPV annually, that you don't have to be promiscuous to get HPV. You can actually be in a monogamous relationship with someone in your 20s, develop HPV, maybe strain 30. That may resolve in some years. And then perhaps in your 30s, you get another strain of HPV. So it's not like chickenpox, how, you get chickenpox once and you never get it again. It's not like that. So when you get HPV and when you think about HPV, you want to think about it in the sense that I could probably get it again. That way you won't rely on the misconception or at least the not the whole truth, or should I say alternative facts, that you never will get HPV again. So keep that in mind, because that is why studies are showing that women greater than 65 years old are the ones that are dying from cervical cancer. And what does that mean? I wonder if they were getting the HPV test. Because just because you get the Pap smear doesn't mean that your doctor is doing the HPV test at the same time. What we realized in talking with LabCorp and Quest is that there's so many different types of Pap smears. There's at least 10 different types of Pap smears that your doctor can order. So keep that in mind and ask your doctor, are they doing the HPV test along with the Pap smear? Because you don't have to have it. Some tests only do the HPV testing if you have an abnormal Pap. If your doctor or if the lab is able to see abnormal cells, then it's like a reflex testing. Then they'll do the HPV testing. So it's not as though you're guaranteed that when you get that Pap smear that you don't have HPV. You could still have HPV, but you just have a normal Pap. You haven't had any changes to the cells of your cervix yet. And so what they were finding is that, more women are dying over the age of 65 from cervical cancer. Of the patients that are diagnosed, you have every year there's over 12,000 people that are diagnosed with hi Broderick, that are diagnosed with cervical cancer, and of that they found that many of the women are over 65. So this is why I say ask your mom and your grandmom when was the last time they had their Pap smear, because the common thought for years, and still is, by some practices, is that if you've had a normal Pap for 3 years or for a few years, that you can stop. But here's why I caution stopping getting Pap smears just because you have had a few normals, is because what I mentioned earlier, you may still have HPV and it may not show. You may not have abnormal cells right away. So you can have a normal Pap smear. The Pap smear only shows the abnormal cells, but you may still have HPV, which can show years later. So unless you've had a complete hysterectomy, if you still have any part of your cervix and you're over age 65, mom and grandmom still should get their Pap smears. The last thing I want to share with you is also in skipping Pap smears, our office manager, her mom, as she mentioned on the show, the TV show last week, her mom only missed 1 year. She missed 1 year of getting a Pap smear. That says a lot. And then the next year, she was unfortunately deceased. So, ladies, don't skip a year. If you don't have insurance, even if you're underinsured, usually a Pap smear, a clinic will probably do a Pap smear for about $100 or less if you can find one. That's enough for you to save for, so that way you don't skip a year of getting Pap smears, because it can happen. My friend only missed a few years of getting her Pap smear and was diagnosed with an advanced stage. And our office manager only missed 1 year. Her mom only missed 1 year of getting a Pap smear. So, and then the following year, unfortunately, she was dead. So please, please do not skip getting a Pap smear. It is preventable. Cervical cancer can be preventable if it is caught early on, at an early stage before it's advanced or spread. They can do things locally to the cervix. They can remove that section. They can cryo. They can freeze it. So they can do a LEEP procedure, conization. There's things that can be done at the level of the cervix before it gets too advanced. So that's really the main things I wanted to share with you. Don't forget your sons when it comes to getting the HPV vaccine. 14 million people are getting HPV annually, and you can get it again. It's not like the chickenpox. You can get HPV again. This is why You don't want to skip a Pap smear. And hi Portal. You don't want to skip getting a Pap smear along with the HPV. Get both. Ask your doctor if they're testing for both, and especially if they're testing for the strains 16 and 18. Because again, you can get the Pap smear and they may not be testing for HPV because there's so many different types of Pap smear tests that a doctor can order. And we realized that, and we decided to make sure that we ordered the Pap smear with the HPV testing. Even if the cells were normal, even if the cervix was normal, we still wanted to see if this patient had 16 and 18. So all our patients get the HPV test along with the Pap smear, but that's not always the case. So ask your doctor what he's doing for you. Hi, Dr. Michelle. So that is it for today's, let's see here. Got a question. Can any liquid come out? Your question, I'm sorry, it's kind of incomplete, Marusu. Hopefully I'm pronouncing your name right. I don't know if you can you retype the question? I'm wondering if you're talking about maybe the signs of cervical cancer. So a lot of times you don't have symptoms, at early stages. It's like, painless. Cancer a lot of times is considered painless. You don't always have symptoms when it's the early stages. It's not until sometimes the advanced later stages that you get, sometimes vaginal bleeding. But yes, you can have, you may be saying like discharge. I'm wondering if you're asking about liquid, like discharge, abnormal discharge, yes. Abnormal bleeding, yes. But it's usually at advanced stages. So that's why you don't really want to wait until there's signs. Because a lot of times when you get to the level that there's signs, it could be potentially too late for at least something locally done. So that's why the Pap smear catches it early on. Okay, the Pap smear catches it early on before it gets to the level where you're showing symptoms. Because a lot of times at that point, it's too late for certain things to be done, that could be done locally to treat. So hopefully it looks like I answered your question. Thank you guys for tuning in. Share this video. Save a life, okay? We're not just talking girls here. We're talking boys and your sons. They deserve to know how the HPV vaccine can benefit them as well. So that is it. I'm Dr. Jerisa ER. You can follow me on social media, all the social media. The other thing, you're welcome. You're welcome. The other thing I want to say is I have the audio book, and it's free. It's free, and it's tips for your ER trip. Hopefully, it will help you to have more beneficial, smooth emergency room experience. So that is free, and that's really it, guys. So hopefully, thanks for tuning in. Share this video and help save a life. Until next time, I'm Dr. Jerisa ER. Bye, guys.